Well, there's a common problem that millions of people deal with every day, and some don't know they have it. We're talking about halitosis, or bad breath. Joining us today is Dr. Matthew Nawrocki of Jacksonville Dental Specialists with the science behind bad breath. What an interesting topic that we're talking about, because some people, I'm sure, know they have chronic, and it's very frustrating for them, and then some people may not know it. And how do you tell somebody that they've got it?
It's an embarrassing thing. It affects people socially, relationships. Most people don't know they have it going on, and so it's not a fun and exciting thing. But especially lately, I just hear a lot of patients saying, I was told, or I noticed this. Does it indicate something? And a lot of times it's just a generally harmless thing, but there's different types of it. Let's
start with it's known as halitosis.
Halitosis,
right?
Right.
Let's talk about it's the medical term.
Yep.
So
that's the fancy word for bad breath, and that's basically what it is. It's the medical term. And there's certain types of it. There's physiologic ones. These are things you eat something like garlic, or you take some omega-3 pills or some fish oil pills like from salmon, and you burp up or something and it smells. That's physiologic, and does have some. And then there's some underlying medical conditions. Kidney problems, lung problems, respiratory problems that emit certain unique odors to the breath, sweetness, things like that, that can indicate you have something going on. But for most people, it's a result or in part because of something going on in their mouth or their throat, their digestive system. And so this is what, for probably most people, this is where the most common area comes from.
Well, let's talk about some of the myths or misconceptions about bad breath.
Bad breath, it's not static. It varies. It can vary in intensity, causes, symptoms, how it's being induced. So there is some variability. Sometimes you have it, sometimes you don't. Like in the morning, that's just a result of the decaying, dying cells being attacked by the bacteria, and that happens.
So sexy.
So. But for most people, they're talking about, we call them pathologic. It sounds a lot scarier than it is, but it has to do with the gums and the teeth and your tongue and your throat areas. This is where a lot of bacteria is harbored. And if you have a lot of gum plaque, tartar buildup causing gingivitis or inflammation, that can lead to that. Or if you have severely decayed or broken teeth that have infection and bacteria, or bacteria on and around the tongue, that can cause a lot of this stuff. And so
you have grooves in your tongue.
Yep.
We were kind of talking about this before the interview, and I nicknamed it groovy tongue.
Yeah.
What is groovy tongue?
Some people have deep grooves or fissures, and some people don't, but this is an area where you can harbor food and bacteria and all those, so you want to be diligent with keeping that clean. Some people who have gingivitis or periodontal disease, they have breakdown of the gums and the bones. This actually dying down or necrosing can lead to a fairly significant odor, and so it does indicate there's an underlying problem. Or if your teeth are severely infected, or they're broken down, or they're decaying and they need some kind of restoration, this can allude to you need to have something done, and this can help or lessen or minimize the amount of odor that's coming from this.
So what do you do? I mean, where do you start with all this now?
The most important thing, other than you eat some garlic or something, that's obvious.
That's conditional.
That's conditional, right?
Okay.
But if it is coming from the mouth, and the first thing to do is get your regular cleanings. Not everyone should come in twice a year, every 6 months. That's really something that's just been fabricated by the insurance industry. There's no real science behind it. For a lot of people who are healthy, it's adequate. But a lot of people, particularly a lot of the patients myself and Dr. Aguila treat, we need them on more routine 3 to 4 month maintenance programs. You have a more extensive restoration, or you're more compromised state, it might be more appropriate. Or people with certain diabetes or other conditions, they actually sometimes can come in more frequently. The other thing is, if it's related to the gums or teeth, getting those problems addressed and fixed can help this problem. Getting your cleanings, sometimes your deep cleanings or different types of periodontal therapy can help this. If the teeth are severely broken down or have a lot of infection, crowns, fillings, things like that, to address that nature can help. And if it's severely compromised, a lot of bone loss, periodontal disease, sometimes taking the tooth out is necessary. Some people have infection, they notice a foul taste in their mouth. That's sometimes the result of because there's infection in there. And so you want to address that so pain and discomfort doesn't happen. And then you'll want to address, obviously if the tooth comes out, then that creates some other problems that you want to address. But those two main things, getting back on track, having a lot of maintenance there, and doing your part in your hygiene, your dental hygiene can help. But a lot of these things are related to the mouth and the gums and the teeth, and really can be be allayed or lessened to some degree.
Well, it sounds like don't ignore it and don't get offended.
Yeah.
Go find out what's causing it. And so what do they do? Do they make an appointment with you and just say, I need to see if I have bad breath, or is there an opportunity to come to learn more?
Well, this is something, if you're not already seeing your general dentist, or you're not coming in frequently, start getting back on track there. If you notice that you have more problems with the gums and bones, you can certainly contact us.
You have a seminar
Yep, we
coming
do monthly seminars. Our next one's July 23rd. We talk a little bit more about implants and tooth replacement, but sometimes some of these problems result in that and then the need to replace that. So get back on track if it's not with us, with your other general dentist, but you can contact us and we can address some of these problems.
All right, well, great information. Who knew there was so much behind bad breath? Well, thank you so much, Dr. Nawrocki. And we'd like to thank Jacksonville Dental Specialists for sponsoring this segment. Call 904-460-4201 to schedule a consultation, or you can visit their website to learn more. It's jacksonvilledentalspecialists.com.